She woke up a few days ago with sneezing, some nasal congestion, a little bit of a dry cough, a little bit of tactile fever, Mom has said. No quiere comer como
No quiere comer comida,
nada.
nada.
¿Y cuántas veces al día está con diarrea entonces? We think this little one's going to recover without any problems, but and she has a good mom, which is also really important. So. My name is Sarah Mayer. I'm a physician assistant. My family and I moved to Baja California in 2008.
My name is Brendan Mayer, and I'm with Siloe Ministries. My wife Sarah runs the day-to-day operations at the clinic.
¿Cómo está usted? Muy bien.
Buenos días. And I do a lot of the behind the scenes. ¿Vas a estar famoso? We initially came down to Baja volunteering with an orphanage, and then God opened up this opportunity.
We saw the need for medical care in the small community of Santa Anita, and we started a community clinic where we see patients at no cost and offer any kind of lab work, radiology, and exams that they might need. Puedes brincar si quieres. When we came down, shortly thereafter, I actually became pregnant with our second child. And when we returned to the United States to have our baby, we thought, you know, we just started this clinic, we're not done. My patients told me, you have to come back, what are we going to do without you? And I knew if we had left, God would provide someone else, but it was very clear to us at that time that our job here was just starting.
You don't give up. I won't give up. You don't give up. I won't give up.
Trajiste las cajas, ¿verdad? This is our main consulting room where we see patients. We have some basic equipment, but enough to do basic physical exams and some preliminary testing on patients. And if need be, we can always send them to a local lab for further testing.
Majority of patients are women and children. Obesity is a big problem locally. Diabetes is a big problem. A lot of challenges locally. We estimate unemployment's probably around 40% for the community as a whole. For young people, it's even higher. There's a lot of drug and alcohol abuse, a lot of broken families.
We provide health care for a local rehab center, a local nonprofit Christian daycare, and an orphanage down the road that has approximately 100 children. We see patients as young as newborns up to the elderly. Part of what we do here is a lot of education. There's way overuse of antibiotics here. Until recently, anyone could go buy antibiotics without a prescription, which made it really difficult because people would self-prescribe antibiotics when it wasn't necessary and for their children. This is Lauren Bell. She's one of our medical assistants. She also volunteers at the local orphanage. She's been a great help and a great support to us. She's bilingual, she loves our patients, and we're really happy to have her as part of our team.
¿Ya tiene expediente?
This is where our dentists come and see patients. We often have visiting dentists who will come. We love it when visiting doctors, visiting dentists, physical therapists, any kind of specialist wants to come down and help us see patients. Buenos días.
Buenos días.
Our family as a missionary family is self-supported, so all of the funds that come in to support the clinic go directly to patient needs, with probably less than 10% going to admin costs.
I'm able to support our family so that everything we raise for the clinic goes directly to the clinic's needs and the patient's needs. If you make a donation to Siloe, it goes directly to the patient's needs because our family's needs are taken care of.
We are a registered 501c3 in the United States, which means that all donations are tax deductible. Materials are always needed. Imagine what your doctor's office goes through in a month. Those are all supplies that we need. When we can get them donated, that's great, but sometimes we can't wait for a donation and we have to purchase those supplies. Entonces, tenemos algunos de los...
People think we're crazy, especially because we have 2 young children, and there's a lot of kind of misconceptions about Mexico and about Baja. People in the United States often ask us if we feel safe, which we do.
I actually feel really blessed that we're here in La Misión. It's a very quiet, safe community.
They often ask us, why would you do that? Why would you leave your career in the United States and come to Mexico? And honestly, we feel like it's a blessing to be able to do it.
We're kind of at the point where we're busting out of our scene. We're waiting for the next step and seeing how much bigger we get and where we're going to go after this.
So we feel like it's actually a privilege and it's really fun and it's something that God wanted us to do.